Welcome to Emergency Chaos, where we provide tips and tricks to make you a better ER nurse. Today, we are going over tips I've learned to keep my nursing license safe, including documentation tips, triaging tips, discharging tips, tips regarding your training, and many other tips that we're going to cover. I hope you get something out of watching the video today, so thank you for your time. Number one is going to be to not have a know-it-all attitude. That's dangerous because you're going to be prone to making mistakes by closing yourself off to additional training and learning. And in the ER, the learning never stops. It's also going to make your coworkers not want to help you. And in the ER, without a good team and having a good teamwork, everything gets harder. With that in mind, you need to foster a sense of teamwork and community. Nothing keeps your license safe like knowing you have a team to back you up, to answer questions, and to help you get through a tough shift. Your team is going to help you clarify questions regarding laws, medication, specific disease processes, and even assist you when your alcohol withdrawal patient is being unsafe while you're next door trying to titrate pressors on the patient next door. So again, foster a sense of teamwork and community. Now, let's talk about doing what you're supposed to be doing. Don't cut corners, especially when you're new. Never cut corners. Do everything by the book how you're supposed to. If you're giving medications or titrating or anything regarding medications, give it your full attention. Do not allow yourself to get distracted unless it's an emergency. Again, do not allow yourself to get distracted. When it comes to medications, give your full attention. Scan your medications and follow the rights of medication administration, ensuring it's the right medication, the right route, the right dose, the right time, the right patient, and for the right reason. If you're unsure about anything, don't blindly do it. You need to ask questions. You need to get clarification and an explanation for the intervention. Because at the end of the day, if you did it and it caused harm, it's on you for not knowing why you performed the intervention. So again, if you are unsure, you need to ask. Also, always ask about allergies and ensure that they are listed. If your patient has an allergy and it's not listed on their chart, you need to be the one to go list it, okay? Next, make sure you know how to waste medications appropriately. And when you're double witnessing a medication, don't just sign. Ensure you actually make sure they are doing it correctly. For example, if they're going to be administering or titrating their insulin drip, you need to know what that glucose was and how much how much insulin they're giving based on the sliding scale. So again, make sure you just don't just blindly sign. You need to ensure that they're doing what they're supposed to be doing. Next, don't turn off alarms on monitors unless you know exactly what you're doing. Don't turn off alarms on monitors. And then do your assessments and don't cut corners with them. If a patient is saying that they're short of breath, however, they look good to you, you still need to listen to their lungs. You still need to auscultate, and you still need to ask thorough questions to make sure that nothing gets missed. And if you mess up, you need to own up to it. Don't hide it. If it gets uncovered, and it will get uncovered, you're going to be worse off for trying to hide it. You're new, change the viewpoint from a mistake to a teaching point. Now, let's get into documentation. As they say, if you don't chart it, it didn't happen. In the ER, it's sometimes not realistic to be able to chart in real time. So what I recommend is having sticky notes or a notepad and jotting down a time and a word next to it that would remind you of what you need to chart later on so that you can deal with the life-saving situation then and then go back and chart. Know that there's going to be times when you want to explain something in detail, but there's nowhere for you to put it in the chart. So what you need to do is write a narrative note. Again, years down the line, you should be able to review your charting and know exactly what was going on. So if you need to write a full narrative note to explain the situation, please do so. It only protects you. Also, never ever falsify documentation. Hence, don't lie. If you didn't do something, do not chart it. And always document the name of who you spoke to. It doesn't matter if it was pharmacy, lab, or the provider. Always document the name of who you spoke to. And finally, ensure you follow up on issues. If you gave pain medications, follow up on it and chart it. Your patient was nauseous and you gave meds, what happened? There's a change in the patient status. What did you do? Who did you speak to? What happened? What was the outcome? Super quick, I made a mini book out of the topics we've discussed on the channel, plus content from future videos like IV tips and what to expect during a cardiac arrest. If it sounds like something that might interest you, or perhaps you want to support the channel, please check it out on Amazon. The link is going to be provided down below in a pinned comment. Now, be aware of policies and procedures at your facility, or at least know how to access them. Does your facility want you to order an ECG and a troponin on patients presenting with chest pain when you're in triage? Who makes the call for when a patient gets a thrombolytic? Do pediatric patients with fevers need to be medicated within a certain time frame? What if your patient has no ride home and they need to get morphine for pain? Things like these may have policies and procedures, so you need to be aware of what they are, or at least have easy access to them. Next, educate yourself on laws regarding HIPAA, holds, restraints, mandated reporting, DNR, DNI, EMTALA, consent, minors, and battery. Bottom line, don't violate any patient rights. Now, with triaging, you should not be triaging patients unless you have at least 1 year of experience as an ER nurse and have taken a triage course sponsored by your organization. You need to assign appropriate priority levels and be able to recognize time-sensitive conditions. And just prior to 1 year, you're not quite there yet. You will get there, but you're not quite there yet, and it's unsafe for you to be doing that. Remember to advocate for yourself if you feel unsafe. And when it comes to your training, if you feel unsafe or perhaps you need additional training in something, voice your concerns. It is your training. Get as much of it as possible. Ask for the toughest assignments while you're training, as it exposes you to different things and you have a preceptor overseeing you. Now, when discharging, you must review the patient's chart, review the discharge information, review the common discharge instructions that are going to be given, verify any questions that you may have with the provider, because you know the patient is going to have questions. So verify anything that you have a question with the provider, and make sure that you feel the discharge is safe. And if not, again, voice your concerns to the provider. Take the time to provide adequate education to your patient as well. I know that it can be busy, but take those few minutes to educate your patients appropriately. This is especially important if you are the discharge nurse in the fast track area and perhaps you didn't have any contact with the patient until the discharge. Again, that's why it's very important that you review the chart and review all the information and the discharge instructions that the patient needs to receive. Now, if you're at a ratio or you feel like you have an unsafe assignment, voice your concerns to your charge nurse and to management, and fill out an ADO form, which stands for Assignment Despite Objection. This is super important, especially if you're new and you're at a ratio and have really sick patients. Also, have nursing insurance just in case. I carry NSO insurance. Don't get into trouble outside of work. Take your lunch breaks, because if you can't perform your best unless you take your breaks and you eat, give bedside report so that everyone's on the same page when you give report. You left your patient looking good, everything's fine, nothing new is occurring. So you give bedside report so that you and the oncoming nurse are on the same page. And then before doing anything, you need to ask yourself, is this safe for my patient? You need to continually learn and ask questions, because the more you know, the more educated you are and the safer a nurse you can be. But again, before doing anything, ask yourself, is this safe for my patient? And if you have any doubt, you need to be asking questions and getting clarifications. Thank you so much for watching. I would really appreciate a like and a follow, and if you learned something today and would like to help support the channel, please consider getting the mini book I put together on Amazon. The link will be in a pinned comment below. As always, you should continue nurturing your curiosity and continue learning daily. With that in mind, please watch my other videos, and I've also listed my favorite ER nursing related books in the description text and in the comments as well. So when you get a chance, please check them out. And if you've learned something recently while at work that may be helpful to other new ER nurses, please consider sharing it in the comments so that we can all benefit and help each other out. Thank you. And as always, teamwork makes the dream work. And here at Emergency Chaos, we are proactive, not reactive.